So Madam Chair, we have quorum and it is 1:30. We're ready to start whenever you
Okay, wonderful. Let me get where I want to be. All right. Good afternoon, everyone. Thanks for joining us this wonderful Monday. Welcome to the Maricopa Regional Continuum of Care Board meeting. I am saddened to announce that MAG staff Sarah Kent has resigned her position and her last day was Friday, July 16th. We wish her well and hope our paths will cross again soon. She guaranteed me they would, so I'm just, waiting her out. With that, MAG staff Chantel Aberton will be filling in to staff the board and the committee until they hire someone permanently for Sarah's position. So welcome aboard, Chantel. I really appreciate you stepping in to fill this role. And for all you out there, I have already had an opportunity to work with Chantel a bit, and I can tell you she's doing a fantastic job keeping me in line. So I know she'll be great. And with that, I'll ask Chantel to commence with the roll call. I'd appreciate it if y'all could introduce yourself and your organization.
Thank you, Chair. I will start with a roll call. Chair Ryan Balch.
I am present and I'm with the City of Chandler.
Thank you. Eric Cole.
Hi, I'm present and I'm with Arizona State University.
Thank you, Eric. Elizabeth DaCosta.
Hello, Liz DaCosta with Community Bridges.
Hi, Liz. Marshall Franklin.
Good afternoon, everyone. Apologies for not being on camera. I'm walking back into the building, but I'm with the City of Phoenix. Thanks.
Thanks, Marshall. Tad Gary. Okay, no Tad. Bruce Liggett. No Bruce. Joan Service.
Hi, Joan Service here from the Arizona Housing Coalition.
All right, thank you, Joan. Charles Sullivan.
Charles Sullivan, ABC Housing.
Thank you, Charles. And Jackie Taylor.
Hi, Jackie Taylor, Save the Family, present.
Thanks, Jackie. Did I miss anybody? Okay. All right, go ahead, Chair.
All right, thanks so much. A little bit of housekeeping for everybody. For all participants, please mute your phone or computer when you're not speaking, and please do not put your phone on hold lest you want us all to hear about everything that's going on in your organization. I'd also ask that all participants please identify yourself when you're speaking. We'll try to remind you to do that throughout the meeting. MAG operates committee meetings and the COC board meeting in full transparency, giving the public access to committee meetings, materials, and discussion. Unfortunately, the public cannot view the comments entered into the chat box, so we are disabling the chat feature for this meeting. If you need technical assistance during the meeting, please contact the helpline or you can contact Chantel directly. We appreciate your understanding in helping to maintain transparent discussions for the benefit of the public. One final housekeeping item, all votes will be roll call votes and Chantel will call the roll after each motion is made. Now we'll be conducting the call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Chantel, were any comments received?
Yes, Chair, we received a request to speak from Amy Schwabenlander, Executive Director at the Human Services Campus, for agenda items 5 and 7. She will provide her comments after the board discussion for those items.
Okay, wonderful. And thanks, Amy, for calling in. It's very much appreciated. I know that the system is a little different than it used to be, but I really value public input and I'm very happy to see people using the system we have in place. So thanks again, and I look forward to your comments. We'll now move on to the next agenda item, which is the consent agenda. And items 3A and 3B are on the consent agenda. As a reminder, please note that board members may request that an item be removed from the consent agenda if there is a need for discussion. Board members cannot comment on a consent agenda item without first requesting it be moved to discussion. Does any member of the board request a discussion on any of these items? If so, please state your name and the agenda item you'd like removed. And if you can help me out, staff, I can't see the whole board right now, so if anyone's raising their hand or.
No, nobody is raising their hand.
Okay, thanks so much. So hearing none, do I have a motion to approve the consented items? Again, please state your name.
So moved, Bruce Liggett.
Hi, Bruce, welcome.
Thanks.
Thank you.
This is Charles, I second.
Thanks so much, Charles. So we have a motion from Bruce and a second from Charles. Now I will hand it over to Chantel, who will provide or proceed with the roll call. Again, please indicate clearly with a yay or a nay or something more creative after your name is called.
Okay, starting with you, Chair Ryan Balch.
I'm gonna go with here.
Okay, great. Eric Cole,
Aye.
Elizabeth DaCosta,
Aye.
Marshall Franklin,
So since Ryan did hers, I'll say for sizzle. That means yes and like Snoop Dogg talk per the kids.
Right on.
No, seriously, I'm a yay.
oh, good. Tad Gary, not here. Bruce Liggett,
Aye. Can't beat Marshall on that one.
Joan Service,
Aye.
Charles Sullivan,
Aye.
and Jackie Taylor.
Aye.
The motion passes. Thank you.
All right, thanks everyone. So at the June board meeting, you'll all remember we had the opportunity to discuss various priority areas for new member recruitment and decided to open up immediate recruitment for a West Valley representative. Right after our last board meeting, and I mean right after our last board meeting, MAG staff sent a survey monkey out to our West Valley municipal partners, and we've received one application of interest. That application is from Chris Hallett with the city of Peoria. So with that, I wanted to open it up for discussion of the board about that application. Reminder, just identify yourself before speaking.
This is Bruce. Could you remind, we had an end date, right, with our request? So the end date is coming past, is that right?
Yes, that is correct.
And it was sent broadly out. I recall Amy was nodding, yes, so, okay.
Yes. And if I'm not mistaken, and staff, please correct me if I'm wrong, we did make sure that there was discussion with all of the West Valley partners. And I think that this was I don't think it was just that Chris was the only applicant. I think that they agreed as a West Valley group that he would be the applicant.
Oh, okay, good.
Yeah. Is that correct, Amy?
Madam Chair and members of the board, yes, it's our understanding that there is consensus among the West Valley communities that they were in support of Mr. Hallett's application to the board for membership, and we did not receive any others. We did send out the announcement very broadly. We sent it out to the Continuum of Care Board, the committee, the related groups, as well as to all of the local and tribal governments within the MAG region.
I guess I was just wanting to ask because I know Chris Hallett and have worked with him in the city of Peoria, where he's really knowledgeable about the issues we're facing, has always up to date on what's out there, on what's allowed, whether it's a federal program, what we can do. I think he's innovative, even though he worked for Phoenix before he went to Peoria.
Hey now.
As did Brian.
I'll chime in too, Bruce. I'm not on camera, but hey, watch out.
But in spite of, no, he was great to work with there when he was over housing and there. So I guess I'm just sharing with the board my own personal support for Chris. And I think if he's got the endorsement of key leaders in the West Valley, it makes a lot of sense to me.
Again, staff, I can't see if anyone's raising their
And
hands.
Madam
If you could
Chair,
help me out.
Madam Chair, Jackie Taylor has her hand raised.
Thanks so much, Jackie.
Did we get a copy of that resume? I might have missed it. If you all got it, and Bruce, that was a great recommendation. I mean, and the fact that he's sort of been elected the representative, I would support that as well. I was just curious if I missed getting his resume.
That's a good question. I would like staff to answer, Jackie, because I personally wasn't looking for it because I've had experience working with Chris both at Phoenix and since he's been in Peoria and working more consistently on homeless issues. So I didn't think to look for it, but staff, if you could answer that.
Madam Chair, Ms. Taylor and members of the board, if that was not provided ahead of the meeting, we would be happy to provide that to the members of the board. Nikki, do you want to jump in on that as well?
Yeah, Madam Chair, MAG staff did send it out to you, Ryan, but I don't know if it went out to the entire board. I could definitely get that out to you all so you can review his resume and his application.
Well, frankly, I mean, I think it's late now at this point, so I defer to those of you who know him and know of him, because I didn't.
Well, you might not be there. You know, there's many of us who have that experience, but for those of you who don't, it's okay to speak up and say, hey, I need more time. I'd like to see the resume, or if others would just like to speak to how you think Chris would do on the board, that's fine too, but I'm not opposed to, you know, everyone having a chance to look at it if necessary.
And Madam Chair, just by way of context, we don't typically send out resumes with the applications, but we're happy to send out the resume upon request. And so we'll definitely get that out to everyone.
Do y'all feel like, you can see I've been spending time with my Southern relatives. Do y'all feel like you'd like a chance to see that, or do you want to hear from people who have experience and see if you can be convinced?
You know, I have vacation brain, so I apologize. But did we have a committee of the board that like reviewed the resume and is making this recommendation? Because if that's the case, I'm 100% comfortable with the recommendation of the committee. Just speaking for me personally.
Amy, could you speak to that, please?
Absolutely. Thank you, Madam Chair. Ms. Taylor and members of the board, we did not reconvene the nominating subcommittee because the seat was only for one particular demographic, in this case, a West Valley representative, and we did not receive other applications. But if you'd like to have a subcommittee or a subset of the board meet and discuss the application more in depth, then we're happy to do that as well. But just as a reminder as well, during the last board meeting, there was discussion about the need to have a West Valley representative serving on the board and wanting to make sure that we could bring them on in an expeditious way to make sure that they have a full opportunity to be able to participate with the development of the Regional Homelessness Action Plan. And given the timeline, as well as the fact that we'd received the one application for the one seat, that's why we didn't have a more robust process, but we're happy to undertake that upon direction of the board.
My take on this is that it should be the West Valley's decision, and the West Valley did convene and come to consensus. And we do have a qualified applicant. So I'm personally comfortable with it, but I'm also certainly open to hearing if others feel like they need to see more or learn more.
And I was only going to say the other board members should speak because I've already talked. I know Chris Hallett. But you reminded me, this is kind of how we did the last West Valley person, which was Glendale. And I think then we had one name from the West Valley, and we had people saying it should be this person we had from Glendale, and then we haven't filled that spot. So this is more consistent than I recalled it with how we did it last time. So that was helpful for me.
That's helpful. Anyone else have thoughts, comments? All right, if seeing none, I'm going to go ahead and ask for a motion.
I will make the motion to appoint Chris Hallett as the individual representing the West Valley on the COC board.
Okay, thank you, Bruce. Do I have a second?
This is Charles. I'll second.
Thank you, Charles. I don't think we usually do this here, but is it appropriate? Any additional discussion before the vote? Okay. All right, hearing none, I'm going to turn it over to Chantel for a roll call.
Thank you, Chair. I'll start with you, Chair Ryan Balch.
100%.
Thank you. Eric Cole.
Aye.
Elizabeth DaCosta.
Aye.
Thank you. Marshall Franklin. I think she had to hop off, but she said she'd be back on. Bruce Liggett.
Aye.
Joan Service.
Aye.
Charles Sullivan.
Aye.
And Jackie Taylor.
Aye.
Okay, the motion does pass. Thank you.
All right, well, thank you all, and congratulations to Chris Hallett. I have no idea if he's joined us today, but welcome aboard, and we look forward to seeing you at the next meeting and having West Valley representation. That's really important. So now we're going to talk a little bit about the regional model and cost analysis. TJ Reed with MAB will provide a presentation of the regional on the regional profile of data, eviction projections, and 3 different scenarios with associated costs. Sorry, that was a tongue twister. Thanks, TJ. It's all yours.
All right. Can everybody see my screen okay?
I can
Yes.
see it. Looks good.
Okay, great. It's the right screen, which I think is the most important. So, all right. Well, thank you, Madam Chair, and the rest of the board. As Ryan mentioned, we're going to be kind of digging through a few different items today, which are related to the regional analysis. Let me see if I can get this moving. All right. So we're really going to just do an overview of what has happened to date, and then dig into the actual analysis and some of the numbers. We'll have some time, I think, for discussion and questions at the end of this section too. So up to this point, as many of you have been involved, MAG has hosted 10 forums and a capstone event with a lot of different stakeholders. We've conducted surveys with law enforcement, first responders, and people with lived experience, and had a lot of presentations. We've done a lot of research working with many of you on this call, our HMIS team, and a lot of other information and partners to really inform this to the best that we could, right? And that involves a lot of different data and a lot of different research to make sure that this is informed properly. And that was the outreach and research is really in the development of strategies. And so a range of strategies were identified, 14 of them specifically, and those were adopted by this board in May. And so now we're kind of moving on to the next phase of strategies towards implementation. And so once we obtain those strategies, it's really important that we work with our core stakeholders and many of the municipalities to identify tactics that are based off of what was approved by this board and the regional council but really action oriented and focused on specific and pragmatic steps. So we've been working on this and working with our partners, pulling in subject matter experts along the way. We just finished 2 meetings with the regional coordination team, and we had some great subject matter experts, some of which I think Amy Schwabenländer is on the call now. We had some insight from the campus, from UMOM on diversion, from community legal services. There was a lot of great feedback as they presented solid information on a range of topics. And so that's really what we're focused on now. And in September is really just building that action, coming to some level of consensus and focus and action steps for each of the group members. And then October would be really sharing some of that information out so that there could be feedback and review. And then November and December would really be those specific actions would be brought to regional council boards for final approval. All right, and so now as a part of the regional analysis, we really have taken a lot of steps to inform this with data. And again, I'll give a few shout outs shortly to those who are on the phone. But over the last couple of weeks, we've added 16 additional projects to accurately portray some of the capital and operating costs. We identified iHelp as options based on feedback from our partners, and then really just trying to support on a general sense rental assistance administration. What have other people done? What can we do to make that process as smooth as possible for those who are administering the dollars? So you will notice, and I'm going to reference a few documents that are online as a part of on MAG's website. You'll be able to access some of these, and they're chock full of information. So I would encourage you to do so. But we did some regional profiling and looked at the Phoenix Mesa Chandler SA profiles, and you can see that as a document, and you will see that it breaks down a lot of different information, some of which I'll go over in this presentation. But due to time, we're not going to go over every single aspect of that. And so this is probably going to be a slide you've seen many times before, but to ensure that we're all feeling level set with the information here, what we're going to share is simply the fact that whatever method you look at in terms of looking at data, our homelessness problem is not getting better, right? And so that's a very dumbed down version of this. And so many of you has seen the point in time count. We've seen our unsheltered numbers continue to rise, and though with minimal increases in shelter capacity, those have pretty much stayed the same year over year. And so one thing that we did find important, and you may have seen this graphic before, but something that's vitally important is for us to really buy into the fact that the system is a flow and is not stagnant. Right. So if there's 200 people on the streets right now, if we house 200 people, though that is incredible and amazing, that is not just going to end homelessness, right? There are people coming into the system and people going out of it. And so there is a structure and a sense of coordination that is necessary for us to not just end homelessness, but build a system that works for people to get them swiftly through bouts of homelessness and prevent it when possible. And so that's all this is meant to show, is that there are many ways in which our community and our system can resolve and target to end homelessness, whether that be reducing inflow, like targeting and spending money on diversion or implementing diversion tactics or prevention, whether that's reducing the length of stay in our shelters or providing more coordination around our long-term folks and reducing the amount who are actively in our system, or increasing options for outflow, right? Increasing housing options for everybody who's in that. All of those things will reduce homelessness in our system. And so these numbers are from our by name list data from HMIS. And so shout out to our Solari and the HMIS team for supporting along the way of this project with lots of data requests. But this is on the left-hand column, you'll just see what individuals, families, and then it will break it down into unsheltered and sheltered. And then you'll see, so this is real, right? So in May, there were just under 3,000 individuals and 100 families actively experiencing homelessness based on our HMIS data. And so that basically is our sheltered number in May, and it adds up to roughly around 6,369 with our unsheltered. Our anticipated net changes for these populations over the next 12 months based on this flow information goes up by about 600, and that's not taking into account the eviction moratorium and some of the impacts that could cause in our community. So speaking of that, though, one of the important things that we've noticed along the way, and I want to take the next few slides to talk about evictions, and for everybody to take this information, take it seriously, but also take it with a grain of salt. There's a lot of different information around evictions right now that spans from like 1% all the way to 30-some% of renters will be evicted. So we want to take this into account, but we don't also want to just take one piece of data and assume the worst or the best. So as you'll see at the bottom of this slide, you'll see some of the household surveys that the census has done. So for those interested, they have done pulse surveys every couple of weeks. They'll send out surveys to members in the community to answer questions. And one of those questions is, how likely are you going to be evicted in the next 2 months? And at the time that we did this with the week 32 of pulse surveys, 22% of respondents said that they are very likely to be evicted in the next 2 months. And you'll see we also, MAG, worked with ASU to provide analysis on different information related to evictions. So they looked at census data, they looked at some of the funding and the efforts that were going on to project how many evictions are going to happen. And so these bullet points are a few of the findings that they had from their study, which is that overall debt for rent burden is almost around $1 billion, averaging just under $2,500 for each. Income remains slow to stabilize. So if that is the case, many may not be able to afford rent even after assistance because rents continue to increase. On every source that we look at right now, from the AMA to national data, rent, Phoenix and the surrounding areas, especially all in Maricopa, are having significant rent increases. They project that eviction rates remained over double the pre-COVID rates through 2022. And then lastly, they do mention that these increased evictions may cause an increased supply of units. So if what they're projecting is true, so if around 20% of individuals are evicted, that would cause a flood in the market and that would potentially reduce costs. And so they also would say the same thing here, that what we want to do is really take this with a grain of salt, but we also want to be swift to action. Many of you, including many of the municipalities and partners in the room, have taken a lot of action already to try to keep people in their homes, whether that's working with landlords or whether that's doing rental assistance dollars or diversion efforts. And so I applaud you for that. But what we want to do is share that this, regardless of what it is, whether it is on the low end or the high end, not only will that have a significant impact on our community, just in general, it will increase the number of people who are experiencing homelessness, because even if a fraction of those folks are entering homelessness, that's potentially hundreds, if not, and if it's on the high end, it's thousands, right? And so I think this is important for us to have a little bit of a sober moment with this, but also to understand that projecting this information is extremely difficult due to the amount of variables. Okay, so now you'll also see the second document that is provided in the link is a housing solutions menu that goes over a lot of different options. I'm going to share just a few of the definitions just to, again, make sure they're all level set. This is not to insult anyone's intelligence. So if you know this or know it better than me, which you probably do, just be patient, I guess, with us while we go through this. The importance of this is to make sure that we're all on a level playing field with the understanding of these. The other important part is that options can vary. Obviously, each community, each municipality, each local area may have different levels of need and different capacities. And so we are understanding of that and want to make sure that each community can act as according to what is best for them, but in line with some of these regional strategies that we all voted on and agreed to. So some of these definitions, diversion, which again, you see throughout our community, primarily with our coordinated entry sites with the Human Services Campus in UMOM. They provided a lot of awesome data to us throughout this process, and just going through their process of that this is really for people who do not have a place to stay tonight, and they are going to enter the homelessness system. And so the goal is to identify and connect them with alternative resources so they don't have to enter the homelessness system. Prevention is typically for people who actually still are in housing, but at risk of losing their housing. So that's emergency rental assistance. So maybe you have an eviction notice, right? That is prevention versus diversion. Low barrier shelter is really emergency shelter with smaller or minimal restrictions for clients to enter. This opens up the options for people who may be actively using or may have criminal histories or sex offenses, right, to be able to still maintain shelter. Bridge shelter is an option for people who are either prioritized for housing and they typically have a voucher, and it's to make sure they have a safe space to stay and they're connected to case management while they're looking for housing and until they move into housing. A few of the other options, shelter with iHelp models. So this is an emergency shelter option that involves collaboration, typically between nonprofits and local churches. Typically the physical shelter location will rotate. And this is a little bit more palatable usually for municipalities than building brick and mortar. And it's a really interesting opportunity to partner across sectors to solve a complex problem. Rapid rehousing and permanent supportive housing, probably two of the most that you're most familiar with, but it's temporary rapid is temporary subsidy with temporary case management. Support typically is offered for about 6 months, but can be less or more than that. Permanent supportive housing is exactly what it says. It's permanent subsidy and permanent case management. Obviously, there are people who can move on from this, and we encourage that. But the baseline of the program is really focused on those who are most acute and most vulnerable in our community. Okay, so now we're going to really dig into it of the scenarios. I do want to reference up front here, this presentation was submitted prior to a few changes being made. So I'm going to let you know what those changes are based on the feedback from our partners. So there are 3 options here, and we're going to skip over the first one because the first one was to reduce specifically unsheltered population. So it focused on simply building shelter, having some options for housing, but really it was risk mitigation of those who are actively on the streets and we want to get them inside. So what we've done is we've actually just focused on the latter 2, which is reducing chronic homelessness and reducing family homelessness, both of which will have an impact on our unsheltered because we're adding sheltered units, but the emphasis is on really ending homelessness and getting people into housing. And so you'll see the cost estimates here for each of them. And again, we're going to primarily focus on the latter 2. And you will see one question that we typically get from this is, why is the individual's number and percentage so high versus the percentage for families under chronic? And the reason is, in our community, based on the data we received from HMIS and the Family Housing Hub, is there are really very few families that are experiencing chronic homelessness. And again, for those who are unfamiliar with that term, it is a very technical HUD definition, and I'll use a high level descriptor. It's somebody who has a disability, somebody who has frequently been homeless, and somebody who has been homeless for a long time. If you're interested in the very specific HUD definition, which can be an entire flow chart, we are more than willing to send that out to you. But we want to just make sure that the understanding that chronic, sometimes it's used in passing, and this is more of the HUD technical definition. Okay, so now really specifically here, we're going to go to scenario 2 with chronic homelessness. You'll see now the numbers and the cost estimates for each of these. I did want to reference the fact that many of you on the call supported in developing this and providing useful information. So I'll just call out a few. Native American Connections, Community Bridges, ABC Housing, the county, the city of Phoenix, Chandler, and the Housing Coalition, I think, are people on the phone actively. And there were over 16 agencies who supported with this, and we included over 40 projects ranging from shelters to housing. And so first thing I would say is I just really appreciate your responsiveness for all of this, because this would not be accurate or useful information if it wasn't based on reality. So this first model really focuses on high investments into rapid rehousing and permanent supportive housing. And you'll see that it adds just, you can see that there's about 700 additional shelter beds that are added to meet the needs of this truly vulnerable population as well. You'll see the costs associated. So capital costs are related to actually building. We have broken it out. So for non-congregate bridge housing and permanent supportive housing, we did not include building of all of these units. We broke it into percentages, some being rental, some being just voucher based, and some being full purchase and building up from the ground up. And that's why the costs are what they are. If you're interested, I can definitely talk with you after about the specific percentages as well. And then operating costs are simply what it costs to provide all of the other things outside of building. So this includes case management. This includes it, if you have security at your facility, et cetera. It includes all of the operational pieces to support each of these projects. And for families, let me get to the next slide here. This has an emphasis with a very high investment in rapid rehousing. Rapid rehousing is sort of a standard housing, permanent housing option for families, and is the most common based on the feedback from our provider network. And so based on this, there are few capital costs, if any, obviously because they're voucher programs, but this is what it costs in both capital and operating costs. The one thing before we move on that we want to clarify, we are not requesting anybody as we review this to pick necessarily and to say, hey, all right, this is your opportunity to pick between adults without children and families. This is simply scenarios to split out in the way that makes the most sense, because the primary way that interventions are split in our community are for single adults or adults without children and families. And so the idea would be that this is meant to be useful as cost estimates for if people are interested in engaging with these particular scenarios and reaching the outcomes that we're discussing. Okay, other notable options that are for some of our communities who may be more inclined to, who may have not taken as many actions up to this point, or may have more political will to combat. Diversion is a large return on investment if done right, and has low cost, is a low cost intervention. We heard from the Family Housing Hub specifically that only about several percent of the people that they divert, they use money for. Single adults are a little bit different. They spend more frequently, but they spend less money on each diversion. So the point of me saying that is that diversion can be done outside of having money associated with it. It is helpful to have money associated with it to provide flexibility, but it does not need it. iHelp Shelters, as we discussed earlier, is an opportunity to add shelter beds without building or renting. It increases the collaboration between multi-sectors, and it's the cheapest shelter option. We will mention that there are limitations, obviously, to the iHelp model, just because of the fact that it is primarily run through volunteers and coordinators. And so it can be a little bit more difficult to service families and higher needs individuals in those settings, but it is an opportunity nonetheless. So, all right, thank you for listening. I tried to jam a lot of information into a short amount of time. I hope you were able to look at some of this beforehand, and we are more than willing after this conversation too, even outside of the discussion that we have right now, to discuss this in further detail with anyone who is interested. All right. So back to you, Madam Chair, for discussion, I think.
Sorry, I forgot I muted myself. Thank you so much, TJ. I know I've heard this presentation in, several times now in different forums, and it's starting to sink in a real way. So I really appreciate everything you guys have done, and I can see the little tweaks in between as we get more data in. So I really appreciate everybody who continues to send data in. I am guilty of having additional data that I need to send in that I think will be helpful. So first I'm going to ask members of the board for their comments. I'm just going to start with mine really quick and get it out of the way. One thing that, again, I've heard this presentation a couple of times, and this was a new thought that I had today. And I think it's because of a recent experience that I've had in the East Valley. And I don't know how to solve it, but one of the things I'm wondering is if we're not actually catching some of the families that need permanent supportive housing in our data, because we don't have a great system for serving them. And that's not meant to be negative towards any of our providers. What I'm finding is our providers are working really hard to try and serve them, but the barriers are high, obviously, if they're chronic, and they seem to be slipping through the cracks. So we're bouncing them around, trying to find the right provider for them, because most of the family providers have more of a rapid model. And so for the families that doesn't work for, they keep getting sort of bounced out because they're not meeting some sort of requirement that rapid requires. They're not able to get quick income, not able to find childcare for their children. There's substance use going on. There's multiple adults in the families, like parents and adults with children, adult children with children. I've seen lots of different scenarios and been involved in multiple calls in the last couple of months with multiple providers trying to figure out how can we best place this family. They have needs that none of us are necessarily prepared to meet. Like we're prepared to meet the needs of people with high barriers for permanent supportive housing for individuals all day long. We all know what that looks like, but we haven't quite figured that out what that looks like for families. And so I'm just wondering if we could take a deep dive into that. We might even have to start with anecdotal data on those families to see what we've got. But I think we don't have, I'm concerned that we don't have data because perhaps we don't have somewhere for them to land. So we're not catching that. So that's my comment. But again, thank you so much for that. Let's keep adding data. Any other members of the board have questions or comments? I think you're muted, Jackie.
Oh, go ahead, Jackie.
Sorry about that.
There you go.
Just based on our experience as an organization, it's profoundly difficult to categorize a family as chronic given the current definition. And we as community and people within community do everything we can to keep a family from meeting that definition out of concern for the kids. So the effort is always get a roof over the head of the kids, whatever you have to do. That doesn't necessarily mean that the family itself is not dealing with chronic issues. And consequently, they may be sheltered, but they're moving from place to place to place, but they're sheltered by HUD's definition. So when I looked at that number, I was blown away just by our own experience and how underrepresented I believe that is. And again, I can only tell you anecdotal stories. But if there's a way for us as a community to dig deeper in that, my chronic lament is, if we can fix family homelessness, we're starting to cut that pipeline of homeless singles on the other end of a kid's development. So I so strongly believe that this is a dynamic we've got to get a handle on.
Thank you, Jackie and Ryan. I think those are really good points. And if I can reflect back, it sounds like the comment is from both, is a mixture of a couple of things, of potentially missing certain families that exist now that may even meet that definition, but are maybe bouncing around that we're not getting. And then also that what you just mentioned, Jackie, of that chronic definition is very specific and may not meet a lot of families where they're at, but they may need more than what a rapid rehousing intervention can offer. Am I understanding that right?
Yeah.
All
The
right.
bouncing is actually messing with their ability to meet the definition. Because like Jackie said, we all will do whatever's necessary that night when they land on our doorstep because there's young children involved, but then they're unable to continue with the program for a variety of reasons. So they bounce and bounce and bounce and bounce, and we're just missing them. So it's almost intertwined.
Yeah, thank you both.
Liz.
Thank you. Yeah, and I agree too with what was said on the families, absolutely. And so appreciative of the work that's gone into it, because it's exactly what we've needed. Like, let's have data on the problem. Let's understand what we need for the solution. So I really appreciate it. I am just a bit concerned about the removal of the goal for the addressing 50% of our unsheltered population. I would like to see if we know the percentage of non-chronic individuals who are currently unsheltered, because in the same way that we address it for families, it's a crisis for singles too, right? In the heat, like in the weather, sometimes chronic medical conditions, yet they're not yet chronically homeless. So if we're not really kind of setting goals that allow us to be what I think is aggressive in trying to get people off the streets and into sheltered situations, regardless of whether they're chronic or not, then we may be missing a good portion of the population that we can prevent chronic homelessness for. So it is something that I think, this board desired to try to ignite and unite resources, right? And be a little bit more aggressive this year with the goals that we set forth. So I would like to look back at that, addressing our unsheltered population, whether they're chronic or not, and bringing them indoors.
Yeah, no, that's a great point, Liz. And one thing that I will provide clarity on is that it was not the removal of that because there was a shift of focus off of those. It was a confusing item to have three models, two of which were focused on housing and one of which was focused on unsheltered, because people were asking questions on how they add up and how they do this and that. And the issue is that when we do implement like scenarios 2 or 3, you're adding shelter beds, which will necessarily do what option 1 was doing to begin with. So it's not a shift of focus off of those individuals. It's simply we add that into these other scenarios as a byproduct of what we do for these investments. So just as an example, there aren't as many shelter beds that are offered in option 2 as option 1. There's about half. But the thing is, if you want to meet that goal, you can add it into either of the other scenarios by simply increasing the amount of investments in shelter beds that you have. So I hope that provides some clarity, because the intent was not to shift focus off of unsheltered. It was to prioritize and focus simply the shift between single adults and families, and that both of those will have an impact on our unsheltered and getting people not just safe, but also permanently housed.
It makes a lot of sense. And the only concern is there's potential then that we're focusing more on individuals who currently reside in our shelters who are experiencing chronic homelessness. And just because that individual then moves into permanent housing doesn't mean that the unsheltered population is going to move into that existing bed. By targeting 50% of the unsheltered, it may cause us to look more towards low barrier shelter, look more towards, expanding shelter services around our community, as opposed to kind of looking towards the outcomes of our existing shelters, when it may not move folks indoors if we don't expand upon those shelter beds in different ways.
Thank you, Liz.
As a follow-up to that question, this would be to staff. Will there be an adjustment to the two scenarios that are left in terms of the numbers of beds that are added in shelter?
So that would be to the of the call of the groups, right? So as we're discussing this, I think these scenarios are meant to just let you know how much is needed to meet a certain end game. And so we can, if the goal of the community and the consensus is to reduce unsheltered population and decrease our chronic population, let's say, and we get on board with that concept, the idea would just be, well, how much do you want to do it by? And this is the number that you'll need, whether that's 5% or 100%. These numbers can add up to whatever is helpful for the community. So these regional, these numbers are simply just calculations based on the data that we have. And that's why I find them so valuable, is that based on the feedback of the community, they can just be adapted to what the community wants to implement. And then we can say, here's what that will cost, and here's what the need would be on the funding standpoint.
Okay, thank you, TJ. Are there other comments from board members before we shift to public comments? Okay, seeing none, Amy Schwabenlander would like to make a comment. Oh, I'm sorry,
Madam
Bruce, did I
Chair.
miss you?
Bruce, did you have a comment?
Sorry, I didn't know if I wanted to wait and hear what Amy and others might say or what first, but I'll come back to, so we want to know what really the policymakers want to do in terms of a direction. And I get that, and they're the ones, but maybe, and I've not talked to anybody about this, Amy and TJ, sorry, Ryan, but maybe we want to weigh in with our opinion as a COC board to help inform that decision. Maybe because we do this work more than our elected bosses do this work. And they look to us because many of them will come back and say, which is the right one to pick, or what combination of the right ones to pick are there. So maybe at the next meeting or sometime, it's something where we could give them the benefit of our perspective when we've got people like Jackie and Charles and Joan and Liz and everyone else on the who don't work for cities but do this work more than I do. Maybe we want to say what we think it ought to be, or options, but that's a thought. Sorry.
And I guess my question to staff based on exactly that is, when is that opportunity that the board might be able to weigh in on the numbers there? That's what we've sort of said we want to be, right? A policy-making, driving board.
Absolutely. And Madam Chair, so in response to that question, we very much want the board's expertise on this. You are doing this work every day. You have very, very keen insights into what's needed and what are the next steps that the region can take. And so we look to your feedback now at this meeting. We're happy to bring it back at your next meeting as well in August. And in terms of the policymakers, we were hoping to update them in terms of the analysis in the September timeframe. So before the action plan starts going through for information and discussion, and then ultimately after that, in the following months for possible action. So getting your input on this now would be fantastic. And we're happy to circle back with you next month, given the feedback and the direction that we receive at this meeting today. We're happy to update that analysis with your insights.
And I'll just add one other thing on that. We have, or we are adding this to the COC committee agenda as well, to be presenting a little bit more start to finish than this one. It will describe very specifically what the target aim has been, what stakeholders have been included, what steps have been taken, how the providers can be involved, what the next step is for providers and the committee and the board as well. Just wanted to add that in addition to what Amy said.
Does the board have access to the detail? I know I've seen it a couple of times in different forms, but I'm not sure if I've seen it in this one, the detail to how many of what would be added into each scenario?
I do not know personally. Amy, do you know that? Ryan, are you talking about like what is included on this presentation or beyond what is in this presentation?
There is a little bit more detail behind, like you had the in the end cost, but I believe I've seen something that says, okay, this means it would be this many low barrier beds, this many units of rapid, this many units of permanent. I feel like the board should take a look at that and be prepared to make comments if they feel like it needs to be revised.
Of course. Yeah. And so there are, in this particular presentation, we do have the specific numbers of beds and costs associated with each by intervention. We do definitely have more detail on that as well, and can share that based on what would be helpful to each participant to help inform and kind of drive the decision-making forward.
Okay. Yeah, I remember there was one that was real detailed. That was, but this is how many unsheltered there are. This is how many beds if we were going to do 50%, 75%, 100%, just that data. I would appreciate if the board would weigh in on it. And I know that everybody is weighing in different forums, but if there are members, but we probably should weigh in as a board as well.
Mm-hmm. Madam Chair, I think that sounds great. We do have an Excel spreadsheet, which might be what you're thinking of. And we'd be happy to send that out to the board as well. So that's all of the underlying data that was used to populate this presentation.
Okay. And then could we come back as a board to officially weigh in on that at the next meeting? We could vote on a motion of, yes, this is the board's recommendation or something like that.
Mm-hmm. That sounds great. Be happy to do that. Thank you.
Great. Thank you. Okay. Anyone else on the board before we move to public comment? And of course, you can chime back in later as well. So at this time, Amy, I hope you're on the phone. Are you there?
Yes, thank you. Yeah.
There you are.
Thank you. Thanks for the opportunity and allowing public comment. I think this is great work. I'm really excited to see the data in action. And I wish more people in the public would engage in this conversation. I'm glad to hear it'll be presented at the committee because I think it's very important for as many people as possible to understand the math and the scenarios. So a couple of my thoughts, I know I don't have a lot of time. I would challenge everyone to think big and to work on functional zero. I'm not sure what 50% reductions actually do or mean for people experiencing homelessness. And while there's so much money available in the American Rescue Plan, I would just put that out there to say, what does it look like for our community to get to functional zero? And how long would that take? I appreciated the conversation Liz brought up on the unsheltered population. I'd like to see some way of charting the movement of people. So say this housing happens, how do unsheltered people and at what rate would unsheltered people move into shelter and then housing? Personally, I can tell you our organization here at the Human Services Campus, we spend more time addressing neighborhood concern about unsheltered than anything else. And so I have to have answers to what's going to happen for the unsheltered population. And we can't, as a community, play whack-a-mole and keep moving people around in a variety of ways. So I'd really like to keep unsheltered involved in the conversation. And then I guess I don't understand the process of what's happening next and what the action is. So even everything I said and everyone said, I would still say like put a pin in it and call this phase 1 of a cost estimate so we can all get to work, because municipalities are deciding how to spend their rescue plan money. And before we know it, it will be RFP'd out And it may or may not fund things that add up to some big goal related to ending homelessness. So it concerns me when we have this once in a generation opportunity, all this funding and the ability to respond quickly. I think there's enough math here, there's enough logic to put a case together to go to the state, the county, the cities, and my colleagues at the state, city, and county on the call can say, no, that's not true, Amy. But I think there's enough here to make a case and say, this is how we can get started in the Maricopa Regional Continuum of Care on really getting to functional zero on homelessness. And I think that's all. Thanks again for the opportunity.
Thank you, Amy.
Yeah, thanks so much, Amy. Are there additional comments or anything anybody wants to add after hearing Amy's comments?
Madam Chair, it's the other Amy. May I respond to the question about the timeline?
Of course, yes.
Great, thank you so much. So in terms of the timeline, we all agree we very much want action, and we are moving toward that right now. The idea is that in September, we would be drafting the plan on the with the tactics that are being discussed right now, and the analysis feeds directly into that. And so being able to hear the board's direction on if you're wanting to strive toward functional zero or some other measure, I think it'll be really, really important to get your feedback so we can use that directly in the development of the Regional Homelessness Action Plan that we're proposing to draft in September, offering it for information and review in October. That very much includes you as well as the committee, because we want to make sure that we're getting input from you, from the providers. That's really important to this process. And then offering that then for action in November. And so that would go before you in November, as well as the city, town, county managers and the MAG Regional Council on December 1st. So that's the timeline that we're looking at. We agree we're in an unprecedented moment of opportunity, and we want to be able to leverage that as much as possible using and tapping into your feedback and your expertise along the way. Thank you.
And I'll chime in too on that as well, that though that is the time frame, we know that municipalities, the county and state are making decisions as we speak. And that's why these discussions, I think, have incorporated this data up to this point too. So as soon as we make adjustments, we're trying to communicate that out as effectively as possible so that if a municipality decides to take action now versus in November, that is at least informed by the data that we have. And couldn't agree more, Amy, that whatever we have at the current moment is better than nothing. And so being able to provide that to somebody to at least have some information versus none is vitally important. And I think as MAG, that's what we view as like not only something that is good, but necessary for us to do as in the role that we have.
Thanks so much, everyone. What I'm hearing is that we need to move to implementation as quickly as possible to take advantage of the resources that are out there now. So I wholeheartedly support that and look forward to MAG staff helping us get to that point very quickly. So thanks so much. We're going to move on to the next item. Nikki Stevens from MAG will provide an update on the Memorandum of Understanding for Public Housing Authorities and actions taken to comply with this federal requirement and to support regional stakeholders. I'm sorry, I might have missed something. I know that that's about the emergency homeless vouchers. Take it away, Nikki.
Thank you, Madam Chair and members of the board. I'm just providing an update to you all regarding where we're at with the signing of the MOUs for the emergency housing vouchers. So we had 7 different municipalities who have been awarded these vouchers, and it's totaling 771. We have almost every MOU executed at this time. TJ has been working also with the coordinated entry sites. I want to thank Amy Schwabenlander and her team, and also UMOM and their team regarding, this heavy lift of identifying ways that we are able to streamline the process for the PHAs. This is a historic event with the PHAs working with the coordinated entry sites, which historically has not really happened in our community. So this is huge. So we have 5 MOUs executed at this time. We have 2 more in circulation right now through DocuSign that should be signed hopefully within the next day or so. So we're almost there. We're still continuing to discuss and find agencies that are willing to work with this population on the supportive services that are unfunded at this time. So we have hopefully some exciting news that we'll be able to report out on the next meeting about agencies that have come forward to assist us in supporting those individuals with high acuity in the community for this emergency housing voucher program. Does anybody have any questions at this time? All righty, well, thank you all. I appreciate your time.
All right. Well, thank you, Nikki, and all MAG staff who have been involved in this. I know it was a very heavy lift, and thank you to all the PHAs who came together as a group to look at how to best get this program off the ground in the very quick time frame that we were given, and also how best to work with coordinated entry, as that is a requirement of these particular vouchers. And thank you, coordinated entry systems, for coming to the table and trying to understand PHA's needs. They're very different, and we had to all do this quickly. So I appreciate what everyone did to meet each other halfway and really make this effective. I've been reviewing the MOUs, and I think they're very sound. Early on, we had looked at some templates or examples from other communities, and I think ours is stronger and really more responsive to both coordinated entries and PHAs. So I'm proud of how our community worked together. I think it's going to make this program very effective, and I think we're going to meet all of the very quick timelines that HUD has put out in place for us. So thanks, everyone. I can't wait to hear more about the successes of of all of the PHA's programs.
Madam Chair, do you mind if I share one thing on this topic as well?
Please.
Thank you. I just wanted to let everybody know we will be actually sending out an email to you and all of the providers for a training opportunity. There's going to be 2 trainings next week on how to access the EHV program and system, for whether you're an entry point, a shelter, an outreach person, a housing provider, how to effectively engage with this program. There will be 2 trainings next week, and they will be recorded. And then we're also going to be sharing out some basic bullet points for communicating about this to the general public. We do not want to be sharing with the general public, just call the campus or call UMOM and you'll get yourself a voucher. As we know, it sounds nice, but it also is not helpful for the client, for the provider on the other end, or for you, because that's not actually what happened. So expect all of that stuff shortly, and encourage your staff, if they are going to be engaging with clients regularly, to attend or review the recording of the trainings. Thank you, Madam Chair.
Yeah, thank you. And I apologize. And TJ reminded me, we are also going to hold ongoing communications with both the PHA and coordinated entry to ensure there's a smooth transition in all of this. We know this is a heavy lift on both ends, so we will continue to provide opportunities to meet and discuss, and TJ has been extremely helpful as well, and just kind of getting this thing off the ground. So anything I can do, please feel free to reach out.
And MAG team, I'm really appreciative for you guys stepping in and being sort of the glue. That wasn't really written anywhere in this, by HUD. They didn't really probably know what this was going to take to join coordinated entry systems and PHAs. I don't think they thought that through when the regs were made. So thank you for stepping into that very important role and continuing to provide us this really great service of training and everything else. So with that, we're going to move on to our updates. So we will start with our favorite coalition leader, Joan Service, who will provide us, and member of our board, of course, who will provide us an update on legislative issues of interest. And then we'll move on to the Continuum of Care subcommittee chairs to provide us updates on their items. So Joan, I turn it over to you.
Good afternoon, everybody. Can you hear me okay? Okay,
Yes,
perfect.
ma'am.
So I am in vacation mode because the legislature has adjourned. So we get to take a break for a hot minute. And I'll share that we do have a success. We were able to enact a state low-income housing tax credit. Just want to give kudos to everybody on the call and listening, because it was a community effort. It's been an undertaking after about 3 or 4 years of this effort. It's really, it's monumental, but we've got a lot of work to do because now it's implementation time. And to that point, the Department of Housing, has been a critical partner in, a valuable and critical partner in this effort, and they are now going to implement the state low-income housing tax credit. They have a public comment period that is going to be, they're having a meeting, hosting a virtual meeting on Thursday, July 29th at 10 a.m. If you go to their website, you can register to attend, and it's like I said, a virtual meeting and just listen to what they're thinking and what other folks are thinking. I have been asked, what is the coalition stance on what, how it should be implemented, and to be quite honest, we're all going to be learning this together. But I think the reality is that we need to do this efficiently, effectively, and equitably. We need to make sure that we prove this success, because this four-year credit, $4 million over 4 years, equating to about $160 million investment towards affordable housing, is not all that we wanted. We want a significant investment, and this is what we're kind of viewing as a pilot project. Let's show the efficiency. And then let's get the legislature to renew it even further, or to strengthen it. So that's the feedback I have on some of the state legislative successes. There were at the towards the end with the budget conversations, lots of back and forths, and I just sometimes I forget where things left. But I just checked in with Jen Dagermon, and she shared with me, yes, I wasn't dreaming. There is the legislature did invest in funding for homeless youth and families. It's actually going to be a state investment after a couple of years. Right now, it's basically diverting some of the federal funds towards homeless youth and families. But then the state, it'll become borne by the state in a couple of years. Jen, I don't know if you can come off mute. I think it was in 2024 that the state was going to come off. Is that right? Yeah. Okay, great, perfect. Yeah. Small wins here and there. We've got some work to do, but I think the reality is that some of our efforts around restoring the state housing trust fund, we knew would be an uphill battle, knowing that there's such an influx of federal funds, but we now also know that those federal funds are going to start tapering off. So our legislative challenges will renew come January, and we really need to make the case of broad funding to address that federal funding cliff. So happy to answer any questions.
Well, Joan, I'm glad that you're on vacation, or at least in vacation mode. Hallelujah. Thank you for all your efforts this year. That's a big win. It's not a little win, that's a big win. So congratulations and thank you on behalf of our entire community.
Thank you all.
Very much appreciated.
Sorry, I'm a little late, Ryan, but so Joan, the bill for senior homelessness, that camping bill that I could never understand, what kind of got left in the wayside? What does it mean? What's coming back?
Sure. Well, even though the legislature adjourned, they always put all their policy ideas in their back pocket, so that some of the things that we have to fight against will rear its ugly head next legislative session. But some of the good successes, thank you, Bruce, for bringing up the senior homeless shelter funding. The bill that allowed for it basically gave approval for the Department of Housing to expend some of the funding that they had towards a senior homeless shelter in the West Valley. So that also was a measure that passed. The camping ban, or not the camping ban, the structured camping facilities. That's the group Cicero Institute out of not Arizona. That bill died a silent death. Well, I'm not going to say silent death. It is gone. It went away. But we do anticipate that it'll be brought up next legislative session. I think those stakeholders that came in to propose this idea, I'm so pleased that they were shocked by our response and our concerns. So it shows that we are, healthy advocates and attuned and paying attention to ideas being presented by lawmakers. But I do think they have captured the audience and attention of some of our state legislators, so that we need to really make the case and be vigilant. So that'll be something that we'll be monitoring during this off session, and then be in preparation for next session.
Thank you.
Mm-hmm. Good to know. Thank you, Bruce. Excellent questions. Anyone else? Trying to make sure I can see everybody here. Okay. All right. If not, let's move on to our next update. Is Matthew Kelly with us today?
I'm here.
Ah, hi, Matthew.
Hello.
Thanks so much for joining us.
Absolutely, my pleasure. I just have a couple of quick updates, nothing super major today. I just wanted to let everybody know we have started meeting every other week within the Coordinated Entry Subcommittee. We are kind of structuring our meetings so that one of our meetings is kind of an informational sharing, updates, that kind of stuff. And then our second meeting is really going to be focusing on more of a working meeting. And so working on like one or two items where we're going to be working through the details of something and hopefully coming out with some sort of like deliverable at the end of those meetings and being able to present some of those things forward as we need to. So we just had our first two meetings. That seems to have gone well. So we'll see how that goes, and we'll continue to monitor that. We did, thanks to TJ, I think, put out the membership call for the Coordinated Entry Subcommittee. We do have a number of applications already. It does close, I believe, the end of this month, which is Saturday. So if you know anybody who's interested, please feel free to have them apply. Looking forward to that, and we'll be making decisions on membership next month at one of our meetings. Third is the prevention update. We did meet with all of the prevention providers, and we're starting to work through the referral process in the last meeting and kind of really talking through and hashing out some of the details of that. I think we're learning it's going to be a bit of a process figuring out all the details of that, but I think it's been a pretty good conversation. Some of you are nodding, so you're agreeing with that. That being said, we did work through a number of issues and some of the processes, and we're going to be working on updating the policy associated with that. And we are going to be looking at reviewing the prioritization tool that was proposed and kind of looking at what sort of changes and adjustments we want to make. So that work group continues to meet. As soon as we have something complete, I'm sure that it will be presented up through the board. And then lastly, with regards to racial equity, we talked about bringing a number of communities in to present on their racial equity plans and the work that they've been doing to address prioritization and coordinated entry. We are scheduling with, I believe, 4 different communities the week of August 9th to have them come and present on their models as far as what they're doing. As soon as we have that confirmed, I believe there's a doodle pull out for that. We'll be sending out the invitation for that. So if there's anybody on the board who's interested in participating, please let us know and we can go ahead and get you an invitation. And that's it. I guess that's enough, isn't it?
Thanks so much, Matthew. Questions, comments from the board?
Madam Chair, it's Eric. I just kudos to Matthew and the group, because that's a heavy workload and it's exciting to see it going on. So thank you for your work.
My pleasure.
I had a question, Matthew. You said that you guys had met with the prevention providers. Who did you meet with?
If you want to hold on, I can read off the invitation for you. Not individual people.
Is it anybody who provides eviction prevention or rental assistance? Is that what you meant by that?
So it's the prevention providers. So it's a specific category of the ESG funding. So it's called prevention. And so there are a number of prevention providers within our community. I can kind of go through the list right now. We have UMOM, Save the Family, Turn a New Leaf, CPLC, Maggie's Place, CAS has some prevention funding. Let's see here. And I believe those were the providers that we currently have met with right now that have the existing prevention funding. So we were kind of working with them to work through the logistics to make sure that the people who are providing the intervention, that it makes the most sense as how we're building out the system.
Okay, so the reason I'm asking is because my interpretation of prevention, having once been an ESG provider, would be that part of that would absolutely be rental assistance or eviction prevention.
So as far as I understand that it can be some sort of eviction prevention, it's the specific category that we're kind of focusing on. So it's that provider category that we're really focusing on, because those are the direction from HUD as to what we need to incorporate into the coordinated entry. So it's specifically the ESG prevention dollars that need to be brought into the coordinated entry system.
Okay.
So we're working with those specific contracted providers who receive that funding to build that system out. I don't know that I disagree that other things fit into that basic category, right? But I think that we're trying to build out specifically for these providers.
So you're trying to figure out the ESG piece, because ESG providers are required to work with coordinated entry. That totally makes sense. So I'm just trying to figure out as a piece of the system, what are those providers doing with those prevention dollars? I might not know. I'm not sure. Like what service are they providing with it?
So it can be it's a number of different things. So primarily they can be paying some back rent, and I can send you the spreadsheet of that kind of covers all of the things that are covered by the ESG prevention dollars, because it's a number of different categories. But typically they're going to be able to pay back rent and then also rent forward for individuals amongst another other fees that they're able to pay to assist in keeping people in their housing that they already have. So the goal is really not, to keep them in that housing so that we don't have to have them come into the homeless system at all.
Okay. So it makes total sense that you would focus on the ESG funded providers because you're required then. It'd be great for those of us who also provide that service, but with different dollars, to just understand as you move forward what you're doing, so we can see if what you're developing would also be beneficial. I think there's actually probably more non-ESG dollars going to prevention than there are ESG dollars. So if you guys come up with something wonderful, maybe we'll all want to apply our non-ESG dollars to your system as well. So it'd just be great to keep getting updates on how that's coming out.
No, absolutely. And I agree with you. I think that this is a category where there's so many providers who might fit into that prevention category, that how are we integrating and working with all those providers to ensure that the resources we do have are being used in the best way possible. I think this is kind of step one. And I think, part of some of the discussions I've had with individuals is how do we look at some of those other providers in our community to ensure that there's some cross coordination of those resources so that we're not, wasting those resources or not using them to the best ability of our community.
Yeah. Or even when someone who needs a prevention dollar and they're with a funder or a provider that's using an ESG dollar, but they're not eligible for that ESG dollar, how can we then come in and give them a less restrictive dollar or, something like that? So it'd be great to hear what you guys come up with.
Yeah, I think once the system gets pulled together, I think it'll be easy for us to then talk about how we can integrate some of those other aspects into the system so that there's some cross collaboration on it, for sure.
Perfect. Thank you.
Madam Chair.
Thank you.
Madam
Yes.
Chair, it's Eric. I, pursuant to y'all's conversation just now, this is fantastic. I think excellent phase one, step one work, and I realize that it's got some requirements to it. But I think following through on kind of your line of discussion there is almost like I could see us having a parallel prevention analysis and structure, well, maybe not structure, but analysis similar to what we've talked about, what we just went through that TJ presented around housing and shelter availability, because I know this topic, I mean, it always comes up, right? Prevention always comes up. It feels like we never get to it in our planning and planning efforts. It sounds like this is a great opportunity to build upon that as a COC and even kind of reach out to some of those other systems, because, you know, when you get it, the way I define prevention is really pretty broad. And anyway, I would encourage us to build on this kind of the way we've done with the other elements of our regional plan.
Thank you, Eric. Joan.
Hi, sorry, I'm late to this conversation. I don't know how we want to handle this, but you know, on the consent agenda was a discussion around, or was approval around the learning and action and policy and partnership, the LAP grant. And thank you all to the board for approving the governance structure. But I think one of the additional requests was to have it 3 Maricopa COC designees as part of that conversation. And I know the other 2 Continuum have not only, I believe, have also approved and identified 3 representatives. And I just don't want us to wait till next month. I don't know if that's some action that can be taken via email, or if we can have that conversation right now. So I apologize for going out of order.
Okay. I'll let staff respond to your request, if you wouldn't mind, staff.
Thank you very much, Madam Chair, members of the board. Thank you very much, Joan, for pointing that out. We very much want to help facilitate that, that partnership. And so Madam Chair, let me know what you think about this and members of the board, but it seems as though if anyone were interested in serving as one of those 3, to please contact Nikki Stevens and Madam Chair. And then if we receive more than 3, then we'll circle back with the board to help to identify which of the 3 will be serving as the representatives for the board. But we can certainly follow up with an email to the board after this meeting to invite people to let us know if they're interested in serving in that capacity.
Great. If I could, the only caveat I would say is if we could also put a deadline to it, but I'm sure you've already thought that.
Absolutely.
All right.
Yes.
Thank you. Appreciate it.
Doesn't happen without the deadlines. Thanks,
yeah. Thank you.
All right. Thanks, Joan. Thanks, Amy. That's just fine with me. If that's fine with everybody else. I don't see anybody putting up a big fight about it, so looks good. Good suggestion. Okay. Any other comments? I know Amy Schwabenlander, you hopefully are still with us, and asked if you could speak about the board update. So happy to hear your thoughts at this time.
Present. Thank you again. Yes, thanks to MAG staff for taking my request, not knowing what the updates would be. So I appreciate the conversation. I didn't see anything in the notes this month about the coordinated entry assessment. So I'm just wondering if there's any next steps on that. And then on the prevention conversation, yeah, I had to ask DES for a lot of clarification about what they mean by homeless prevention. So I think it's a worthy conversation to map the differences between what Ryan, I appreciate you, the CAP experience of rent and utility assistance as eviction prevention versus what the DES, particularly their language on what homeless prevention is. It's probably a good comparison activity. That's all. Thank you.
Thank you.
Thank you. Madam Chair, I'm happy to respond to Amy's request for an update. Yes, Thank you so much to the board for all of your dialogue and input last month on the coordinated entry assessment. We very much want to follow up on that. It's one of the 4 areas of focus from our racial equity plan, as well as one of the 14 strategies from the regional homelessness strategy portfolio. We are looking into possible funding sources right now and hope to have some more information on that soon. We have been continuing to fine tune the scope of work for that assessment, given the board's input at the last meeting. And we'll be sure to circle back with you before or as we start to put that scope out for a competitive bid to identify the consultant who will be working with us. And happy to take any other questions in that regard. Thank you.
Thanks so much for that update, Amy. I hope that answered your question, other Amy. All right. Perfect. Thumbs up. Thank you so much. All right, move on to request for future agenda items. Do any board members have any action or discussion items for future meetings? I'm going to give you all a moment to think. If not, you're leaving it up to me and MAG staff to figure out. So please do let us know if anything comes up. This isn't your only opportunity. Of course, you can always just holler at one of us and we'll make sure that that gets on an agenda. All right, but oh, go ahead, Eric.
No, oh, sorry, go ahead, Eric.
Sorry, it's Eric. You gave me long enough, so I thought of something.
Okay.
Just circling back to the board membership conversation earlier. We don't need this right now, but I do think I had a conversation with a previous staff person who had talked about open board seats and kind of moving forward on on the board planning. And you all may have discussed this last meeting, and I'm sorry if I missed it. But yeah, I just think some along the lines of some of the questions that were asked earlier, a little more clarity on the board recruitment and selection process would be helpful to me, at least. Thank you. Or if there's things, if they're coming forward, just kind of an update would be great.
Amy, if you wouldn't mind, we did discuss it at the last board meeting, of course. But if Amy could update everyone again, I think that would be great. No, we always need, reminders are always good.
Yes, no, definitely. Thank you so much, Madam Chair and Eric and members of the board. Really appreciate the interest and the high level of commitment to ensuring that the board is growing its membership in ways that are the most strategic and beneficial to the region. We have filled, thank you very much for the action today, the West Valley seat. We will be continuing to work very closely with the board to identify other priority areas, particularly as the regional planning efforts come about. Keeping in mind, and 2 points on that. One, that we've engaged a number of different stakeholders who could be considered for membership through all of the outreach forums that were held just since this past January. And then also moving forward, the Continuum Care Board will be leading its own regional plan effort and may be engaging additional people in that capacity. So we see this as a continuing conversation that we're eager to serve the board and to receive your direction on steps moving forward. And we'll continue to provide updates and possible next steps that the board could consider. Thank you.
Okay, full disclosure, I went back and looked at the notes while you were talking so I could date myself. It said, I noticed the note said something about a nominating subcommittee. Is that in process or is that happening too? And
we would be happy to follow up on that and to work with the chair and to circle back with the board in terms of who would be serving on that committee and what the timeline would be for that. Okay. So yes, absolutely. More to come.
Thank you.
Also, am I just not remembering correctly that we also discussed moving forward with a DEI representative, or am I ahead of myself?
Madam Chair, members of the board, we did discuss that, absolutely. At the time, the priority was to fill the West Valley seat as quickly as possible to ensure full participation throughout the region, with the DEI representative also being a very high priority, and to circle back on that with the nominating committee.
Okay, perfect. Thank you. All right, did I see any other hands up? Checking through. Also, I invite members of the public to reach out to us as well if there are items that you would like to see on the agenda. We want to hear about that, so let us know. And I've lost my, hold on, lost my agenda. I only have one screen to play with today, so it's a fun little challenge here. Okay. All right. Now we are at comments from the board. This is an opportunity for anyone on the board that has other announcements or events they would like to highlight to shout them out. So what you got?
Well,
What is new and fun?
I won't be shy. We have, the Housing Coalition has quite a number of things happening upcoming. We are returning back to, like seeing people in the flesh, and we'll see how this whole COVID thing happens. But we have a golf tournament for anybody who wants to golf in August in Tucson. So I thought that's there. Yeah, I know. And that's going to be on August 18th. And then obviously we are gearing up for our annual conference on October 27th and 28th. And that's going to be at the Mesa Convention Center. I'm sorry, 26th and 27th. I apologize. 26th and 27th. We are soliciting breakout session proposals as well as award nominations. And I really want to hit that home because there's a lot of folks who've done amazing things in the past, 18 months. And it really does feel good to be recognized. So I just challenge everyone to think about that and submit an award nomination on our website. So thank you.
And also, Joan, I assume you guys are looking for sponsors?
Well, yes, but I mean,
yes. So if anybody wants to support the great work of the coalition, and you all know how good this conference is, and it's going to be in person, Joan?
It is. I mean, fingers crossed, we're watching.
Right.
We're paying attention to public health officials and all that fun stuff. And we have COVID protocols in place, but we're doing as best as we can.
Awesome. Good. This is exciting news. Good to hear. And it sounds like your golf tournament is in conjunction with the ADOH conference. So if people are going to be down there and you want to get some golf in, good opportunity. All right. Anyone else? Bruce.
Hi. Sorry I joined a couple of minutes late. So if Amy St. Peter if that's a real shot of where she's at, I'm not at. That should be blocked out there. Block that. Anyhow, I don't know why I'm getting more reflective these days, but to think about where we are in July, and I know I've missed most of the last year and a half, not knowing what day it is, but seems to me we got seriously underway with these discussions in February. And we have come an amazing to be at this stage. And I just think we should all maybe pause. And there's been so many times when I think it's moving fast. What are they doing? I didn't know this. I didn't have input. What's that group? What is this collaborative? How are we, and we, Amy and the team and all the partners and all the community groups who've supported it, data requests driving us crazy, TJ and all, but wow, look what we're looking at, numbers that are multi-year. They're talking about 50% reduction. Amy Schwabenländer talks about, functional zero, great concept. I mean, so it's just, I'm so proud of what we did, and we all had those feelings. But now looking back, it's well, whatever that was, we're on a good track. And I just want to thank everybody who's been doing so much on this. It's exciting time to be part of it. So that's all. Thanks.
Thank you, Bruce. Thank you very much. Any other announcements? Anyone wants to share events? Pats on the back.
So this is Marshall. I'll share. I stepped off because our city manager announced his retirement. So Ed is retiring effective October 6th or the 8th. Yeah.
Congratulations to Ed.
Yeah. I see Eric's face.
Well deserved, Ed.
Yeah. Those jobs are 24/7, 365, even when you're on vacation, you nonstop. And he said in his announcement that, he's been promising his wife, he's been in the role 8 or 9 years and was assistant city manager before then, as many of you know. And he said he's been promising his wife 12 years to take a vacation in the fall. And this will be the first time he can actually do that. So he said he's looking forward to that. So that's why I had stepped off for a few minutes so that he could share that announcement with the department head. So if you see him, congratulate him, truly deserving to be able to ride off into the sunset. So.
And I remember, Marshall, when Frank retired, he said the exact same thing, but he said, I've been promising my wife for 23 years that we would take a vacation in the fall. That was crazy. Yeah, so it's a big job. Thank you so much to Ed for everything he's done. Yeah, thanks for sharing that with us. All right. Anyone else have time to think and anything to add? All right. I have to go back to my notes. Hold on and make sure I'm not missing anything. I think that this will be adjournment, but let me go check. Next screen over. Let's see here. Yeah, that was it. All right. It was great to see everybody. Happy July. And are we still in July? Happy almost August. And I'll see you next month. The meeting is adjourned.
Good. Bye.
Bye, everyone.